Hello everyone, my name is Ty. I'm here today to give you a speech in regards to type 2 diabetes and how it affects teenagers nowadays. Imagine being just 16 years old and sitting in a doctor's office, hearing that your body is already being damaged by a disease most people don't develop until their 40s or 30s, 40s or 50s. For many teenagers, this is not just a scary thought, it is their reality. According to the Center for Disease Control and Prevention in 2023, thousands of teenagers were diagnosed with type 2 diabetes each year, and those numbers continue to rise. Even if you do not personally have diabetes, learning about the issue matters. It can help protect your friends, family, and even yourself in the future. Type 2 diabetes among teenagers is a growing health crisis caused by poor diet, lack of physical activity, and genetic factors. The good news is that it is preventable through healthier lifestyle choices, education, and community support. Today I will first explain why type 2 diabetes amongst teenagers is such a serious issue and a growing problem. Next, I will discuss the main causes behind the rapid increase. And finally, I will share practical solutions that can help prevent and manage this disease. The problem. Let's talk about the problem. To begin, type 2 diabetes amongst teenagers is a serious public health problem that continues to grow every year. In the past, this disease was extremely rare in young people. However, a major study published in 2017 in the Journal of American Medical Association by Dr. Dana DeBellia and her research team found that the rate of type 2 diabetes amongst U.S. adolescents has increased by over 30% in the past 2 decades. This means more young people than ever before are being forced to manage a lifelong illness. This disease does not only affect blood sugar levels, it impacts nearly every part of the body, according to the American Disease Association in 2023. Teenagers with type 2 diabetes faces a higher risk of developing serious complications later in life, including heart disease, kidney failure, nerve damage, and even vision problems. These complications can interfere with everyday activities and significantly lower quality of life. Type 2 diabetes also affect emotional and mental health. The Mayo Clinic reported in 2023 that adolescents with type 2 diabetes often experience stress, anxiety, and emotional exhaustion because managing the disease every day can feel overwhelming. Many teenagers struggle to balance schoolwork, friendship, and medical responsibilities, which can lead to feelings of isolation and frustration. In addition, diabetes places a heavy financial burden on families. According to the Center for Disease Control and Prevention in 2023, the costs of diabetes care, including medication, glucose monitor, medical appointments, and hospital visits, can create serious financial stress, especially for families without strong health insurance coverage. Clearly, type 2 diabetes is not just a minor health concern. It is a serious issue affecting physical health, emotional well-being, and family stability. Now that we understand how serious this problem is, let's look at what is causing the rise of type 2 diabetes amongst teenagers. Let's talk about the cause. One major cause is poor diet. Many teenagers today consume large amounts of fast food, sugary drinks, candy, and processed snacks. According to the Center for Disease and Control and Prevention in 2022, frequent consumption of sugary beverages and food significantly increase the risk of obesity and insulin resistance, which are major factors of type 2 diabetes. This unhealthy eating habit make it difficult for the body to regulate blood sugar properly. Another contributing factor is limited access to healthy food. The World Health Organization reported in 2021 that many families, especially those in low-income communities, struggle to access affordable, nutritious food options. when fast food is cheaper and easier to find than fresh fruits and vegetables. Teenagers are more likely to develop unhealthy eating habits that increase diabetes risks. Lack of physical activity is another major cause. Many teenagers spend several hours each day using their phones, on their computer, and gaming. The World Health Organization also found in 2021 that a large percentage of adolescents do not meet the recommended daily levels of physical activity. The sedentary lifestyle leads to weight gain, poor cardiovascular health, and increased diabetes risk. Genetics also play a role. According to the National Institute of Health in 2022, the teenagers with a family history of diabetes are significantly more likely to develop disease, especially when combined with unhealthy lifestyle habits. This means that for some teenagers, making healthy choices is even more critical. Now let's talk about the solution. Nowadays, now that we understand the cause, let's explore solutions that can help prevent and manage type 2 diabetes amongst teenagers. One of the most effective solutions in making healthy personal lifestyle choices, according to the Mayo Clinic in 2023, teens can significantly lower the risk of developing type 2 diabetes by maintaining a balanced diet that includes fruits, vegetables, whole grains, and lean protein. Even small changes, such as drinking water instead of soda or choosing healthier snacks, can greatly improve long-term health. Regular physical activity is also essential. Teens should aim for at least 60 minutes of exercise each day. This includes playing sports, walking, biking, or even doing home workouts. The Center for Disease Control and Prevention in 2022 emphasizes that regular physical activity helps regulate blood sugar, maintain a healthy weight, and reduce stress overall. Beyond individual choices, schools and community plays a major role in prevention. According to the Center for Disease Control and Prevention in 2020, schools that provide healthier cafeteria options, expanded physical education programs, and health education classes help reduce obesity and diabetes risk amongst students. Community programs also make a significant impact. The American Heart Association reported in 2022 that community-based programs focus on nutrition education, physical activity, and health awareness, encouraging teens to develop lifelong healthy habits. Peer support groups and public health campaign also help teens feel motivated and supported in making healthier choices. In conclusion, type 2 diabetes amongst teenagers is a serious and growing public health problem caused by mainly poor diet, lack of physical activity, and genetic factors. However, it is largely preventable. Through healthy eating habits, regular exercise, and education and community support, we can protect the health of today's youth. Every healthy choice you make, whether choosing nutritious food, staying active, or learning about diabetes prevention, brings us one step closer to stopping this disease. The time to act is now, before the next generation faces a preventable health crisis. Thank you.